Today, the group and I are going to be explaining cardiovascular disease and how it impacts Indigenous Australian men. Cardiovascular disease refers to conditions that impact the flow and circulation of blood to the heart and the overall health and functioning of the heart. Cardiovascular disease, or CD, is a term used to encompass many conditions such as hypertension, coronary heart disease, congestive heart failure, rheumatic heart disease, and strokes. Cardiovascular disease is the leading cause of premature death for Australians. In 2019, 42,000 Australians passed away due to cardiovascular disease. Cardiovascular disease also increases the likelihood of hospitalizations with the increase in age. However, there are ways to prevent cardiovascular disease, such as eating a healthy, well-balanced lifestyle, exercising regularly, and maintaining blood pressure. Now that we have established a basic knowledge of cardiovascular disease, we're going to be looking at the discrepancy in how cardiovascular disease impacts Indigenous Australians compared to non-Indigenous Australians. Unfortunately, the founders of our country are more disadvantaged within our healthcare system. A study investigated how cardiovascular disease impacted Indigenous Australians specifically, and it was found that 17,300 hospitalizations of Indigenous Australians are due to cardiovascular disease. Within this current presentation, we're going to be looking at how specifically Indigenous Australian men are particularly affected by cardiovascular disease. Indigenous men are at high risk of cardiovascular disease. They are 2.5 times more likely to report cardiovascular disease than the average Australian man. When looking at these men, they are at the highest risk in every socio-economic area and in rural, remote, and metro areas as well. You can see in this diagram here. This displays how critical it is to target these areas as they are at heightened risk. Within the next current slides, we are going to be investigating this.
Health issues for Aboriginal men are a result of history and extreme hardship they endured through displacement, stolen generation, and denial of citizen right. As a result of intergenerational trauma, Indigenous men are socially, economically disadvantaged and suffer from health disparities. This has resulted in influences such as employment. Aboriginal men have significantly higher unemployment rate than non-Indigenous men. This can be observed in Figure 1. Consequently, the main source of income becomes a government pension or allowance. In turn, this impairs access to healthcare as individuals have difficulty accessing specialist facilities due to lack of income. Furthermore, purchasing treatment and medication needed for treating various conditions such as cardiovascular disease, which is prevalent among Indigenous men, is low due to income. A low income also results in individuals purchasing low-quality foods according to their budget. So preventive methods such as purchasing healthy and quality foods are not evident. Aboriginal men living in rural and remote areas experience challenges accessing healthcare facilities and specialist services. Due to the distance, there aren't many facilities available for health concerns, which can affect their health. In addition, Aboriginals have a holistic view of health. They value not only physical health and well-being, but also social, emotional, and cultural well-being. Due to the limited number of programs and services that focus beyond individuals' physical health, this can negatively influence their health. Therefore, a lack of culture-appropriate health services can result in a decrease in access and prioritization of individual health. Aboriginal men experience 3 times more burden of disease than women due to excessive drinking and drugs, and almost twice the burden due to coronary heart disease. Intergenerational trauma endured through discrimination and racism negatively impacts physical and mental health.
In many parts of the world. So why are we seeing such high smoking rates in the Indigenous community? This often results in exposure at a young age, whether it's directly smoking the cigarette or secondhand exposure, most likely increases the likelihood an individual becomes conditioned to smoke. So the epinephrine and norepinephrine chemicals are often associated with high blood pressure, leading to cardiovascular disease and heart diseases such as coronary heart disease or ischemic heart disease, therefore contributing to the 60% likelihood in increase we've seen in the Indigenous community and specifically the men developing the cardiovascular diseases. So the cultural barrier is essentially, well, many Indigenous communities are often bound to their medicine, such as herbal remedies. This may be due to language barriers in which communities between the groups are often challenging, but can also be due to the trust and integrity these Indigenous communities have on their own medication. However, these medications and remedies aren't up to date compared to westernized technology such as x-rays or echocardiograms. This often leads to higher severity of disease, which could have been prevented.
Having a healthy diet can assist Indigenous Australian men in reducing the rates of cardiovascular disease or CVD. Consuming a high-calorie diet can result in weight gain, coronary heart disease, CVD, and hypertension. Indigenous males are more at risk as 72% of adult men are more likely to consume unhealthy foods and sugar-added drinks compared to 56% of women. According to Kelly, we can conclude that Indigenous Australian diets pre-colonisation were very nutritious as they included protein, fibre, polyunsaturated fats, and complex unrefined carbohydrates. Indigenous diets have drastically changed due to colonisation, with the introduction of processed foods, saturated fats, salts, and sugars. Indigenous Australian males who frequently have inadequate sleep pose a higher risk of developing cardiovascular disease. Poor sleep can be identified as having less than 7 hours of sleep, waking up during the night, and having trouble falling asleep. According to Tobaldini, people who have insufficient sleep risk increasing inflammation, oxidative stress, and dyslipidemia, which increases the probability of developing cardiovascular disease, leading to higher rates of morbidity and mortality in Indigenous men. 15 to 35% of Indigenous Australians are more likely to have less rest compared to 11% of non-Indigenous Australians, with mainly Indigenous males being more susceptible. As a result of this, Indigenous men may have a higher prevalence of developing these health conditions. As specified by LeGrap, we can determine that Indigenous Australians may experience more disruption in their sleep due to overcrowding in homes. Participants who slept in a motel or a house without overcrowding for the study found a significant improvement in the amount and quality of sleep. This demonstrates how correct sleeping environments can greatly improve our sleep and reduce Indigenous men's risk for cardiovascular disease.
Today I'll be discussing barriers in healthcare and how this affects Indigenous men, specifically those with cardiovascular disease. Examples of barriers include socioeconomic status, access to healthcare, and discrimination. There are many barriers in the Indigenous community which make it harder to access adequate healthcare services, such as those residing in rural areas. Healthcare accessibility to Indigenous Australians in rural areas is significantly lower compared to the public residing in the city, for example. According to Maroon, for every $1 that is spent on healthcare for the general population, only 0.74 cents is spent on Indigenous Australians. Most Indigenous men reside in rural communities where there is currently a decline in healthcare professionals and a decline in the Indigenous men's health rate, deteriorating at an accelerated rate compared to Australians who reside in urban communities. In consonance, rural communities across the world are in a state of flux, and Australia is no different. Rural communities are aging at a faster rate than urban communities, and young people are out migrating in large numbers, according to Alston. Today I'll be discussing enablers in healthcare and how this affects Indigenous men with cardiovascular disease. Examples of enablers include transportation services, the pharmaceutical benefit scheme, trust, and accessibility. Other factors such as transportation services to and from hospitals make it simpler for Indigenous people in rural locations to receive healthcare services. This enhances the possibility that Indigenous males will seek treatment, lowering mortality rates. Subsequently, the introduction of the pharmaceutical benefit scheme has developed into a key enabler to Aboriginal people accessing healthcare services. In regional and remote communities, this is reported to be the availability of government subsidies. These included closing the gap PBS copayment and travel subsidies. The closing the gap PBS copayment was described as having increased medication adherence for patients who would otherwise be unable to afford their medications. Trust and accessibility also increases the number of people who decide to trust doctors and take their medical advice. This will lower the number of people who are undiagnosed with cardiovascular disease and increase the likelihood of people being diagnosed at an earlier stage.